Welcome to Gamble with Brandl. Today we have a 31-year-old woman that is brought to the ER for severe headache, chest tightness, nausea and photophobia. Has been going on for 2 hours. Prior to the onset of symptoms, she had attended a networking event and she had some wine and also aged cheese. The patient has a history of depression and she takes further daily medications. And her temperature is 37 degree, pulse is 90 beats per minute, respirations are 20 per minute, and blood pressure is very high, 195 over 130. She's alert and oriented. The patient's symptoms are caused by which of the following? And we have here a list of medication. So what is going on with this patient? So if you're thinking about the patient's symptom, what is definitively here key is that her blood pressure is very, very high. And actually all the symptoms, headache, chest tightness, nausea and photophobia, could be due to this high blood pressure. So which of these drugs can lead to a high blood pressure? Particularly if we are thinking about she had 2 glasses of wine and aged cheese. Now let's think about this medication. So she has a history of depression, and actually these are all antidepressants. Let's go through them quickly. So amitriptyline is a TCA, a tricyclic antidepressant. Phenelcin is a MAO, a monoamine oxidase inhibitor. Mirtazapine is what is called an atypical antidepressant, a serotonin antagonist, and also an alpha-2 antagonist. Duloxetine is an SNRI. And then sertraline is a SSRI. Now, which of them in combination with aged wine and cheese could lead to such a thing that we call hypertensive crisis? That's what this is. Hypertensive crisis. Well, if you're thinking about what is in red wine and cheese, aged cheese, there's actually something that's called tyramine. And tyramine by itself is an indirect sympathomimetic. So it indirectly mimics the sympathetic nervous system because it increases norepinephrine. Okay, so tyramine is metabolized by MAO to some metabolites. Well, now when we are dealing with a patient that is on an MAO inhibitor, so let's suppose she is on an MAO inhibitor, what's going to happen? Well, the tyramine cannot be degraded. So the tyramine is going to go up, so it cannot be metabolized. Tyramine is an indirect sympathomimetic leading to increased norepinephrine. So norepinephrine is going to significantly increase our blood pressure. Now, the correct answer for this case is she is on phenelcin, an MAO inhibitor. And this is a typical scenario. Now, MAO inhibitors are very old antidepressants. They're not used a lot anymore. Nowadays, only for what's called treatment-resistant depression. So if you have already tried a lot of different antidepressants and still didn't find anything that had an effect, you may end up on an MAO inhibitor. What are the others? Could they have anything to do with increase in blood pressure? TCAs usually do not change your blood pressure. They are inhibiting the reuptake of serotonin and norepinephrine, so therefore you're going to get some norepinephrine increase. However, there are also alpha-1 blockers, so that's not likely that your blood pressure is going to go up. Mirtazapine is a serotonergic antagonist and also is an alpha-2 antagonist, so also nothing there. Duloxetine is an SNRI, so that definitively increases norepinephrine and serotonin, but the blood pressure would never increase to 195, so that's really a hypertensive crisis. Go up maybe a little bit. Sertraline is just increasing serotonin, so that also should not necessarily do something to your blood pressure. So here we have to do with this hypertensive crisis due to the interaction of an MAO inhibitor with food, aged cheese or any fermented food containing tyramine. I also wanted to point out, if somebody thought about serotonin syndrome, there is some overlap also in serotonin syndrome. You're going to have high blood pressure, but usually there's also something with the muscle. So you have an increased muscle stretch reflex. And also there's impairment in the mental status. So here she's alert and oriented. That also doesn't fit. Usually patients with serotonin syndrome also have fever, hypothermia. That also doesn't fit. So there's a lot of things that really don't fit, and there's also not a drug-food interaction. So the correct answer here is an MAO inhibitor, and you're going to end up with a hypertensive crisis.